To the breast cancer depending upon the stage of the disease. If the breast cancer can be treated by surgery, medication, radiotherapy, immunotherapy and breast conservative therapy. It all depends upon the stage of the breast cancer. If the breast cancer is confined only to the breast, it can be treated by surgery first shot. If it is confined to breast and involving the nodes underarm, we have to treat with the neoadjuvant. That is to start prior to surgery and then proceed with surgery later. That this is the downstaging the therapy and completing the therapy by surgery. Surgery is the end therapy for curable breast cancer. That is stage 1 and stage 2 can be cured by surgery. More than stage 3 we can try downstaging by giving neoadjuvant chemo and radiotherapy and then proceed with surgery. The cancer in the breast can occur as a hard mass within the breast. It can produce skin changes over the breast. It can produce just bloody discharge from the nipple, or it can appear as a lump in the armpit. There is one condition which will mimic breast tumor is eczema of the breast. Usually eczema will occur in both the breast, whereas Paget's disease, which is confined only to the involvement of the skin, will occur in single breast. Dimpling of the breast, the skin can be found when there is the lymphatics are obstructed by the tumor mass. Whenever we come across any change in the breast, it is better to seek the help of a medical practitioner. And the best way to detect is triple examination, that is self-examination of the breast, which can be confirmed by ultrasonogram and mammogram and FNAC of the lesion. Usually mammogram is advised after 40 years. Before 40 years, if they have not completed their family way, ideal will be ultrasonogram or MRI. What is self-examination? Self-examination of the breast is nothing but the patient themselves can use the right arm to examine the left breast and left arm to examine the right breast. They are supposed to put the palm of the hand over the breast and go one quadrant over the other quadrant. The breast can be divided into 4 quadrants as upper, inner, upper outer, lower inner and lower outer. Each quadrant has to be examined with complete care to find out any change in the breast. Treatment modalities available for treating of the breast cancer are surgery, radiotherapy, chemotherapy, hormonal therapy and immunotherapy. Surgery is the mainstay for curable breast cancer, which will hold for stage 1 and 2. If it is in stage 3, we can downstage the tumor by neoadjuvant chemo and radiotherapy and take for the curable surgery. Radiation therapy can be done prior to surgery, post-operatively and for recurrent cancer of the breast. Chemotherapy is advised for cases which are actually hormone negative, so that these patients will be subjected to chemotherapy either prior to surgery or post-surgery. Hormone therapy are given to tumor mass which are hormone positive, which are more curable than hormone negative tumor masses. All the therapies are effective if it is combined, and the choice depends upon the stage of the tumor. More than the stage, it depends upon the individual tumor biology and the individual body capacity for the cure of the tumor. There is no limit for occurrence of breast cancer in a particular age. It can occur between age of 18 to any age. How to prevent it? There is only awareness. Prevention is better than cure. I congratulate the entire unit for taking such a good effort in organizing and making public aware of the situation and hoping to cure breast cancer from the root level. Please support Chennai Turns Pink. I support too.